feel free to, as Elaine suggested, make some personal observations or comments. Feel free to ask our last two speakers some questions, or feel free to tell us what we missed or whatever. The floor is open for your discussion. Susie?
Kimberly, is there any potential to use NHANES for some of the questions that you want to?
So the question was if there's the potential to use NHANES, which has been it's a validated survey instrument that's been around for over a decade's worth of data. So you're asking if retrospectively we could go back and analyze some of those data. So I've not worked explicitly with the NHANES. I have explored the opportunity to do that, and I believe that the reporting on the nutrition programs, specifically I've looked at home delivered meals, and I remember that the N was pretty small for that program. So I can't speak to the other programs that are represented. Perhaps members in the audience who are more familiar with it could say whether or not we could utilize that resource. But the questions are validated and are good questions that we could go further. But one thing that I do want to point out that NHANES doesn't have as much information about that I really think the senior nutrition programs do. One of their benefits is the socialization and the role of these programs in being in their homes and promoting interactions with other individuals. Some of that information is missing from NHANES, which I believe is a valuable outcome to investigate.
We have two people at the microphone. I think it's Greg and Holly.
Thank you. So just one quick thing, just to follow up on NHANES. NHANES is great for looking at SNAP or National School Lunch Program, School Breakfast Program, or WIC. There's really a lot of underreporting in NHANES for the home delivered meals. That's probably not a good thing. The only thing I would add to your thing is put up food insecurity as one of the outcomes you're interested in particular. So that would be the only comment I'd make about that. Elaine, great summary of everything. And so, but everybody can say, oh, you missed this, you missed this. It was an excellent summary. Just two things I think might be worth mentioning is, first of all, the role of multi-generational households. I think we have to talk more and more about that. It's also a way of bridging. Oftentimes, people talk about seniors, people talk about children, and I think more and more we have to talk about the two of them together in a lot of these homes. I think having grandchildren in the homes poses some really serious challenges for seniors. I think we can begin to talk about that. So that's one thing that I would add to that. The other thing is, and I think you touched on this, but I think that we have to begin thinking about, or more and more talk about mobility issues amongst seniors and the challenges that propose. People always talk about food deserts, and we can have a discussion about whether food deserts are relevant or not. But for a lot of seniors with mobility issues, even if there's a food store half a block away, that may not be relevant for their thing. So in some ways, food deserts should be thought of at an individual level. And I think that's something else that we want to talk about. But those are just two minor things, and excellent summary.
Yeah, thank you for that.
Thanks, Greg. Holly Gerling.
Hi, I just wanted to say how pleased and thrilled I am for this whole event. The only thing that I would, I've been culturized about this is that we have to define who exactly the population is that we're talking about, because when you start at 50 or 60 and go to 110, the variations are dramatic between those age groups. And also the language we use. I have been discouraged from using the word elder or senior. So I think nowadays it's kind of older adults. I'm not sure that's quite the right language, but at least people don't seem to be a little taken back by being considered an older adult. So those are my only two comments.
Good comments, Holly. I think it is more contemporary to use the terms older adults or talk about aging or talk about being older. And people don't like to be called old, but they can say I'm getting older. And the other thing is that we have shown in a number of studies, and that are shown by others, is that older adults are among the most likely to change their eating habits if they have good reasons and the knowledge to do so. We're not all old dogs that don't want new tricks. We are older dogs that want new tricks. older adults are very, very, very receptive to new information on healthier eating. Why? Because they want to maintain their independence, they do not want to become dependent, and they do not want to leave their homes. So if there's one takeaway, we are eager for new information about healthier eating and how to stay healthy and stay independent. Dependence is something we dread. Jean Lloyd.
I just wanted to make one other comment about some of the data that's available and studies that people might be interested in. When Kelly was talking on her one slide about Older Americans Act nutrition programs, there is a national evaluation occurring at this time. She alluded to the fact that there is a process study that will be available. All 56 state units on aging, half of the area agencies on aging, and a sampling of nutrition service providers. So that's process study and a cost study. It should be up on the Administration on Aging website at sometime in November. As Nancy mentioned, there is the research brief in the agenda there that discusses some of the information from consumers' point of view about the Older Americans Act nutrition programs, both congregate and home delivered. There are all the survey tools are available. It does very brief information on what's available, but participants, chronic conditions, etc., for the people served in the program, such as numbers of medications they consume, etc. And there's data available on that. There is also another part of this national evaluation that will be occurring. It's in the field right now, that will be doing individual outcomes. So it looks at food insecurity, social connectedness, chronic conditions, medications, healthcare utilization, not point in time, but longitudinal across a number of years, matching Medicare data with participants and non-participants for hospital admissions, nurse, emergency rooms, etc. That data and that report, probably 2017 or something, both of those are being done by Mathematica Policy Research.
Thanks, Jean. Another comment or question at this microphone?
Yeah, I'm Nathan. I work with Beth at Mom's Meals, and we started off as a senior nutrition provider. And not to make this more complex than it already is, because there's been great conversation the past couple of days, but since then we're now providers for TBI, for brain injury, for AIDS, HIV populations, and a huge population physically disabled. And so incorporating them, I think, is a key thing. And then it gets down to funding. We all recognize all these issues, but to think that there's waiting lists on HCBS programs for people who are at risk of being institutionalized, it's just going to cost the government more money. Doesn't seem to make a lot of sense. And then, from that, who goes and gets that money and gets people off waiting lists, I know is a whole other challenge. But potentially including the physically disabled population maybe gives us more of a voice as we go through that. So just a couple comments from a provider's perspective, what we've seen as we continue to grow. So.
Great comment. I think that we could learn a lesson from the school nutrition program where they have free, reduced, and full pay. I think some of our local providers could find a new audience of full pay older adults who want to pay and don't want, quote, charity. And so the quality of the meals, the marketing, and all those are new approaches to broadening the number of older adults who can maintain their independence and not end up in nursing homes earlier. Another comment.
Hi, my name is Jane G. I'm a physician researcher from University of California, San Francisco. And a lot of my research is in minority and immigrant populations, of which that probably is the largest segment of growing population when older adults. And I think we don't want to neglect and explicitly state how we need to evaluate how culture influences food choice, and actually how accessibility of programs that we've been talking about are oftentimes limited for these populations due to language and culture. And so I think that should be explicitly stated, and I think when we talk about the dearth of information for older adults, there's even less available on a large scale for these populations. So as a person that studies them, I feel like it's important for me to advocate for that.
Perfect reminder. Great, great. Julie.
So, Callie, I wonder if you can talk to us about people who are on waiting lists, what the quality of the data is regarding people who are on waiting lists, and if you know anything about differences between people who are on the waiting lists and those who get served, and whether they are more vulnerable.
All right, great question. So I don't know of any national data that's available about older adults who are on waiting lists for services. The study that we did surveyed 8 different programs across the country that had waiting lists of greater than 3 months. And we found that their characteristics, the number who don't have money to buy the food they need, who don't have 12% have reported having no one to call on for help. Their social isolation was really pretty scary, in fact. So they have needs, but there's not resources available to meet those needs. But I don't know, to answer your question, I don't know of any data that's being collected nationally about the waiting list, and that's something that we should think about.
We do know of many people on waiting lists who end up being readmitted to hospitals or who die before the services become available. So the prioritization, I think you mentioned that, Elaine, and the targeting is a big issue still for us, whether we're in the private or the public sector or a combination. Another comment over here, probably our last comment.
Okay, my name is Munene. I'm an intern at Iona Senior Services, but I'm a student in Eastern Kentucky. And my comment is on built environment. We talk about proximity, we talked about it yesterday, but I think we should go the extra step of actually seeing whether proximity is actually proximity. What I mean by that is, here in Washington, D.C., it's easy to walk across the road, there are places to walk and all that, but if you go to Kentucky, for example, just going to Walmart 2 blocks down the road is almost impossible to walk. So I think just the role of like the Department of Transportation or building, and just how they integrate and make sure that when we say there's a park 2 blocks away, it's actually 2 blocks away walking distance.
Right.
You don't have to, I don't know, just the connection between mobility and actual ways to pass through to get to the places we're talking about.
Perfect comment. I think that transportation, we know that transportation is one of the most highly demanded or highly sought after services, and that many people don't get to their community centers or their senior centers because they can't get there, and they are only there on the days that they're driven there. So getting to a store, I always say if you can't get out of bed, it's hard to get to the kitchen, let alone the grocery store. So we really have some challenges there. So I'd like to close with inviting Gordon up to say thank you. Gordon was the chair of the Planning Committee. It's been a delight for me to be on the Planning Committee with so many of you and to work with such excellent staff from the Food and Nutrition Board, have the support of AARP, and we had over 30 presentations, so you've heard a lot, and you've been a wonderful audience. Thank you.
Well, I want to first encourage everyone, if you have any follow-up feedback or suggestions, certainly feel free to email any one of us. I do want to highlight to the small group that's sticking around to work on the BMI workshop proposal, just stay in this room. Apparently where we're meeting is impossible to find without leaving breadcrumbs, so stay here. Lastly, I want to express my personal gratitude to the Food and Nutrition Board staff, to our Planning Committee, to our wonderful speakers, and most of all to our wonderful and persistent audience. So have a great day, and thank you.